Hello everyone, so this is Tuti Pathak and you're watching my channel. So today I will talk about NABH Science 5th edition core objective elements. It's the part 2. I have uploaded the part 1 on my YouTube channel, so you can check out the part 1. And please don't forget to like, share, subscribe my channel. You can also follow my Instagram account, which is Healthcare for You Forever. So let's get started with this particular presentation. Now I'll talk about core objective elements. So certain objective elements in the standard have been designated as core objective elements. These are objective elements that the organization should have in place to ensure the quality of care or safety of people within the organization. Core has been used to identify such objective elements. So as we all know, what is core? Core means the main. So without which the organization cannot be run or administrated. So it is very important to have these core elements in place in the healthcare organization or any hospital, because if these standards or these elements are not being maintained properly in the healthcare organization, so obviously the organization will not survive in the long run. Okay, so let's move on to the next slide. Now I will talk about the core objective elements of chapter number 6, patient safety and quality improvement. So the first one is PSQ1A. The patient safety program is developed, implemented and maintained by a multidisciplinary safety committee. So obviously in the organization there will be a multidisciplinary safety committee which will ensure the patient safety in the healthcare organization or the hospital. Then PSQ1I, the organization adapts and implements national and international patient safety goals and solutions. So obviously there are some standard international patient safety goals that every organization, healthcare organization or hospital adheres to. PSQ2A, the quality improvement program is developed, implemented and maintained by a multidisciplinary committee. So there's a different committee for the patient safety, and then there is a quality improvement multidisciplinary committee as well to ensure the quality in the healthcare organization or the hospital. PSQ2H, there is an established process in the organization to monitor and improve the quality of nursing care. Now we'll talk about the rest of the core objective elements of the chapter number 6, patient safety and quality improvement. PSQ3B, the organization identifies and monitors the key indicators to oversee the infection control activities. So these are the indicators which help to monitor the infection control. Okay, these are mentioned in a piece of paper and it is recorded and maintained in the records, and these indicators are really very important to monitor and control the infection. PSQ3D, the organization identifies and monitors key indicators to oversee patient safety activities. So basically there are different indicators for the infection control and different indicators for the patient safety activity. PSQ4A, the organization undertakes quality improvement projects, and PSQ7A, the organization implements an incident management system. So obviously if there is a fall in the organization, if there is a fall of a patient, so that incident is being captured and recorded and maintained in the record. So it is very important to understand the incidents that happen in the organization, in the healthcare organization. Now we will move on to the next chapter, chapter number 7, which is responsibilities of management. Okay, so now I will talk about the responsibilities of management. Responsibilities of management, ROM 1A, those responsible for governance are identified and the roles and responsibilities are defined and documented. So in the organization there are various staff members who are basically identified, and they are assigned the role of to manage the hospital or the healthcare organization. ROM2B, the leaders establish the organization's ethical management framework. So obviously ethics has to be maintained in the organization. Without maintenance of the ethics, it would lead to a lot of loss and the fraud. ROM3C, the leader is responsible for and complies with laid down and applicable legislation, regulations and notifications. ROM5A, management ensures proactive risk management across the organization. So risk management program is really very important to avoid the risk in the healthcare organization or the hospital. Okay, so now I'll talk about the chapter number 8, facility management and safety. So the objective elements of facility management and safety are as follows. So first one is FMS 1A, patient safety devices and infrastructure are installed across the organization and inspected periodically. So there are safety devices to ensure that the patient safety is always there through these devices. FMS 1C, facility inspection rounds to ensure safety are conducted at least once a month. So this is basically facilitated by the staff members, okay, of the safety committee, and they basically ensure that the inspection rounds are being maintained. Then FMS2C, they are internal and external signpostings in the organization in a manner understood by the patient, families and community. Potable water and electricity are available around the clock. So these facilities like electricity, water, or having medical equipments properly in place, medical gases, generators, these are the facilities that are apart from the human resources or uh, any other resources. This is what facility management and safety is all about. FMS 3E, hazardous materials are identified and used safely within the organization. FMS 4C, the documented operational maintenance plan is implemented. Now we will talk about the last four objective elements of the facility management and safety. FMS 5C, the documented operational and maintenance plan for medical equipment is implemented. FMS 6B, medical gases are handled, stored, distributed and used in a safe manner. FMS 6D, alternate sources of medical gases, vacuum and compressed air are provided for in case of failure. FMS 7A, the organization has plans and provisions for early detection, abatement and containment of fire and non-fire emergencies. So this chapter basically contains everything which is not in relation to human resource or patient safety or quality improvement. It is something which is very different from all these aspects. It involves medical gases, medical equipments, fire and non-fire emergencies, generators, ACs, everything which supports the procedures and the surgeries that happen in the hospital, or the processes that happen in the hospital, electricity, water, everything. So this was all about facility management and safety. Now we will move on to the next chapter number 9, which is human resource management. Okay, so now I'll talk about human resource management core objective elements. Chapter number 9. HRM 1B, the organization maintains an adequate number and mix of staff to meet the care, treatment, and service needs of the patients. So obviously, every organization needs adequate number of the human resources to operate the organization. So whether it is a healthcare organization or any other organization, human resource is very important. So there should be an adequate number or mix of the staff, like how many nurses are required, how many doctors are required, how many paraclinical staff is required. So everything is being maintained, and according to that only the recruitment is done. So HRM 2A, written guidance governs the process of recruitment. So there's a recruitment procedure to hire the doctors, nurses and the paraclinical staff. HRM 2C, the organization defines and implements a code of conduct for its staff. HRM 3A, staff are provided with induction training. So obviously whenever an employee joins the organization, and induction training is given to give the overview about the healthcare organization or the hospital, and tell them about the rules and regulations and the ethics that are being followed in the organization. HRM 4A, written guidance governs training and development policy for the staff. So after induction is done, then training and development of the particular employee and the group of employees is done. So now I'll talk about the next objective elements of the human resource management. HRM 5E, staff involved in direct patient care provided training on cardiopulmonary resuscitation periodically. So this is very important, cardiopulmonary resuscitation. Obviously, if the patient is not in a good condition and if that patient is not breathing, then obviously we have to give immediate cardiopulmonary resuscitation, and each and every persona or the human resource who is there in the healthcare organization has to learn the cardiopulmonary resuscitation, especially for those who are directly involved in the patient care, like doctors and the nurses. HRM 6E, staff are trained in the organization's disaster management plan. This is also really very important. Disaster management, everyone should know about it, how to handle disasters. Then HRM 6F, staffs are trained in handling fire and non-fire emergencies. HRM 8D, disciplinary and grievance procedures in consonance with the prevailing laws. So if there is a problem between two staff members, or between one staff member of one department and another staff member of another department. Okay, so now I'll talk about the last core objective elements of human resource management. So HRM 11D, medical professionals are granted privileges to admit and care for patients in consonance with their qualifications, training, experience, and registration. So obviously, since they are very experienced, they are qualified to do surgery, so they are granted privileges to take care of the patients. HRM 12A, nursing staff permitted by law, regulation, and organization to provide patient care without supervision are identified. HRM 12D, nursing staff are granted privileges in consonance with their qualification, training, experience, and registration. Obviously, it's as same as the medical profession. Nursing staff have their own qualification, trainings, and experience, and according to that, they are granted some privileges to treat patients. Okay, so now I'll talk about chapter number 10, Information Management System. IMS 1A, the organization identifies the information needs of the patients, visitors, staff, management, external agencies, and community. So basically, in this particular chapter, Information Management System, there's an identification of the information needs of the patient. So patient will have many information like their height, their weight, their medical history, their parents' name, and where do they live, their personal details, and their medical reports and examinations, MRI reports. There are many things. So obviously, organization identifies that information needs to be collected and it needs to be recorded. So there's an identification of the information. IMS 3C, the medical record provides a complete, up-to-date, and chronological account of patient care. So basically, this means a sequence-wise records are maintained. Okay, and even in this records, date-wise medical reports are being filed into that record if it's a physical record, not a medical record. And if it's a medical record, so obviously date-wise the computer adjusts all the information, it records all the information according to the date. So this is what it means, provides a complete, up-to-date, and chronological account of patient care. IMS 5A, the organization maintains the confidentiality of records, data, and information. IMS 5B, the organization maintains the integrity of records, data, and information. Now we will move to the next slide, which is the last slide of this particular presentation, which will talk about the last objective elements, which are the core objective elements of information management system. Okay, so now I'll talk about the last 5 core objective elements of the information management system. Okay, so first is IMS 5C, the organization maintains the security of records, data, and information. IMS 6A, the organization has an effective process for document control. IMS 6B, the organization retains patient clinical records, data, and information according to its requirement. And IMS 7A, the medical records are reviewed periodically. So basically, the information has to be maintained, has to be recorded, it has to be secured. So everything has to be done in a proper manner. And there are physical records and there are digital records. So digitalization is very much important now these days, because it basically gives security to the records and patients' clinical data. So digitalization of the records has been a trend these days. Okay, electronic medical records are a common topic these days, and they are being used to retain and secure the data of the patient. Thank you everyone for watching my channel. I hope you really like this video. Please do not forget to like, share, subscribe my channel. Thank you so much. Bye bye.